here's my doctor told me to stay away from vitamins altogether because they may interact with chemotherapy. Well, the study that we just talked about today says that there may be some issues with certain types of antioxidants and radiation therapy. High doses of vitamin C have been shown in certain research studies to interact with chemotherapy. So the patient may wish to stay away from certain types of herbs where they don't know the side effects, and they may want to resume the vitamin regime post-chemotherapy. But in general, I'm looking at vitamins in terms of their effects on the immune system. I can't really say that vitamins are going to help with longevity or any other issues that people may be talking about. I'm strictly looking at, what does the research say? And I think that most of it has got some good things, but if there are some issues in terms of vitamin C or antioxidants with radiation, you want to talk about that with your doctor and stop taking it for a while. That's a pretty easy thing to do. The last one I have here, where I've had people say, well, I feel very, very weak. What types of exercise can I do? And I always talk with instructors to say that you can actually have people do breathing exercises two or three times a day, which helps them oxygenate the body, but they're not going out for a 30-minute walk, or they're not lifting weights, which is very difficult for them. They can also practice Tai Chi, which is an excellent form of phase 1 exercise. They can do certain types of mat Pilates exercises. And I know that I have some friends in Houston, Texas, at one of the big medical centers there, who have been promoting NIA training, which is a movement training for cancer survivors for many years. So that's actually coming into its own as an adjunctive therapy for the exercise world in terms of applications for people who still are feeling very weak during chemotherapy or radiation treatments. Okay. So one of the last slides I have here is the use of exercise or cancer wellness in social media. And here's just some of the groups that I'm affiliated with: the International Cancer Advocacy Group, Academy of Oncology Nursing Navigators, Oncology Administrators, the Association of Community Cancer Centers, which is one of the big groups that I've been affiliated with for a number of years, Oncology Nursing Society, the Oncology Network of Doctors, Oncology Pharma. You can see complementary medicine for oncology professionals. And the last one down there in the lower right side is therapeutic massage for pain control, which has a lot of interesting research in terms of the application for cancer patients. And I get information from almost all of these centers or all of these social media outlets almost on a daily basis. Many of them I don't read every day, but there's always a gem in there at least once a week. And case in point was the antioxidant article this morning. That actually came from, I think, the Oncology Professionals, CAM, a social media outlet. So I think that this is becoming more important. I'm getting most of my information from this, and not just research articles, but people's opinions. What do people in the field of oncology administration or oncology nursing think about certain types of issues, new drugs coming on the market, or pricing structures, or reimbursement, or government policies, et cetera, et cetera. So I get to learn a lot about the cancer field right now just by clicking my emails and opening up and seeing what some of the discussions are for the day. And I try to carve out about 5 minutes or so a day to read some of these types of things that I feel are very important. So I would urge people in the Medical Fitness Association, if they're interested in some of the social media stuff, I would highly recommend the ONS, the ACCC, the Oncology Professionals, or CAM. Whatever ones that you think there might be. There are many, many types of LinkedIn associations that you can join and discussion groups that you can be involved with. I put my 2 cents worth in once in a while too, and people actually listen to it. So I think they're a really good thing to have, and I would, I'll talk with Jim here later if people want to just take a look at this slide. They may want to copy down some of the names and go to some of those discussion boards and just see what they're all about. So in closing, in terms of our Cancer Fit Care program, I'm very proud to be working with Medical Fitness Association this year. I think that they are right on board in terms of really making this an important program. I'm working on the next edition of my education program. It should be out very, very soon. I have most of my content done. Our new website, cancerfitcare.com, will also be up very soon. And I want to have a shout out to my friend and colleague who's actually celebrating a birthday today, Mr. Phil Tumarello from Advanta Health Solutions in Newark, New Jersey. I'm sure he's on the webinar today. Thank you, Phil. And I hope to be speaking at some regional meetings and workshops here in 2012, probably starting in April. So I'm hoping that some of you that are on the webinar today, I may actually be able to meet with you face-to-face at some point here in the very near future. And I think the timing is right for the growth of cancer wellness and medically based facilities. It's been about 15 years. We've got a solid foundation of research, advocacy, and programs that are already there. I think there's a real great collaboration happening with oncology physicians who are very supportive of exercise, by the way. I have yet to meet an oncologist that has said exercise is no good. Also, primary care physicians